Okay, Minister. So I want to begin with an update on the Fileria Mass Drug Administration.
Well, um, it's good that you have asked that question because we have now completed the program. As you know, we started this program a couple weeks ago, and I'm very pleased to report that the program is now completed. Overall, our assessment is that we have achieved about 70% of the population would have received the filaria pills. We were aiming to get at 65%, so we've exceeded it, and they're now mapping up and doing the numbers. So I think it would even be a little bit higher. So I want to thank everyone who has been involved in this campaign. I think they did a fabulous job of going out, reaching out to people, encouraging them to take their tablets. And now that they've taken the tablets, we've been able to accomplish this feat of 70% of our population taking the tablets. The next step in this process is that we'll finalize those numbers. Then we'll invite PAHO WHO to send a team in to verify what we have completed. And once they're satisfied and they can verify the numbers that we currently have, then they would certify Guyana as being free from filaria. And that's a good achievement because we have been battling with filaria for many, many decades now. And to be able to eliminate filaria from Guyana is a real feat. And this would have been a challenge that generations of doctors would have tried to work on and to eliminate this disease from Guyana. But the team that we currently have, and of course the people um, who participated in this exercise, have helped us collectively to eliminate this disease from our country. So I want to thank everybody. There are multitudes of people who have worked in this campaign. I want to thank them because they've done a tremendous job, and because of their efforts, we would soon be declared filaria free.
Minister, that's great news indeed. I wanted to also ask you for persons who may have missed when the personnel, the health medical team would have passed around to distribute the tablets and so on. Is there any way that they can go to get it?
Well, the program has formally come to an end, so accessing those medicines now would not be available, excepting if there's an urgent need. Well, then we have the offices of the vector control unit. They would be able to provide some guidance and provide a treatment if it's necessary.
Okay, Minister, thank you very much. And like I said, it's good news. Today is also World TB Day, and I wanted us to speak to that a little bit. How have we been managing with TB in Guyana?
Generally, we have done quite well with TB in Guyana. We have been able to reduce the cases of tuberculosis in Guyana, and we have introduced a number of innovations to help to monitor those patients who have had TB. Because, TB treatment, it's a long treatment. It can take months for a person who is infected with the TB bacillus to receive this treatment. And therefore, one of the challenges is compliance. So people sometimes don't want to take their meds after a month of taking medication, and that has really been a challenge. So we had introduced something called DOTS, that is direct observation therapy, and we have started using persons to come to give you your meds and to observe you drinking your meds. And that has worked because it helped a lot of the patients with compliance. And because of that, we have been able to reduce the burden of tuberculosis in Guyana. We have also introduced through our TB program the use of GeneXpert's machine to be able to diagnose tuberculosis. And the TB program was one of the first programs that brought in these machines, start doing testing using these machines. And now, fortunately, because we had some of these machines, we had been able to repurpose them to work on COVID. Um, with this capacity and knowledge that we have from TB, we were able to now put it to use during the COVID pandemic. But that's an innovation that came from tuberculosis. Of course, the TB program continued to have these type of equipment, and they're going to continue to test people so that we can detect our TB cases as quickly as possible. We have also been using an electronic system to monitor for TB, and that too has been of recent vintage, and it's certainly helping to better manage the cases that we have in Guyana. One of the other challenges that we have to look out for, if people don't take their medication in a timely manner, then we can have patients who develop resistance to some of the current TB meds. And when you see patients with those type of resistance, we'll have to move to, say, second-line medication. That is something that we worry about because we have had in the past a few cases like that, and they have been very problematic to manage. So as we celebrate World TB Day, we still have a number of challenges that we have to work on, but I'm very satisfied with where the program is today and the work that they have been doing. We also continue to monitor the challenges that we have with patients who have HIV and have a TB co-infection. These patients also can be problematic because with the HIV infection, if their HIV infection is not properly controlled, with the addition burden of TB, it can easily overwhelm them and their immune system. So this is another category of patients that we've been working on and to help to reduce the burden of these co-infections.
Right. Just for my clarity, the second line medication, what is that?
So when somebody come in with TB, we have a regimen that we'll use, and most people would have their disease being resolved using these medication. But then sometimes because over the period of say 3 months, when we keep monitoring them, we might find that the medication in the first line is not working as effectively. And in those cases, we monitor for resistance to the medications that we are giving. And if we find that there is resistance, then we move to another set of meds that we'll offer as second line. And then if people are resistant to that, then we have another set of other medicines that we can add. So it is a stepwise process, but we start with one set, and then if people fail on those medication, then we move to the other set. So they have lots of protocols relating to these things, what meds to use when, how do you detect failure in people not, treatment failure, how do you detect that, and when you detect that, what do you do? So it's a very carefully thought out process, and many of these things we are guided by the protocols that the WHO has put out.
All right, thank you, Minister. For a non-medical person like myself, it would seem as if there's sort of a similarity between how TB is transmitted and how COVID-19 is transmitted. So I want us to talk about that, and specifically, would TB be considered a comorbidity of COVID-19? And further, if anybody's being treated for TB, can they also take the COVID-19 vaccine?
So that's quite a lot of questions in one. There are similarities in terms of well, I wouldn't say, in terms of the method and how it's transmitted, because with TB, people can get it through contact with an infected person's sputum. With COVID, this is more droplets and aerosol infection, so there is some connection there. Outside of that, though, we popularly know TB to be a disease that infects the lung. COVID also starts by infecting the lung. But then in TB, you have what is called extrapulmonary TB. That is TB that occurs outside of the lung. And we have had cases of that as well, where the TB has infected other parts of the body. In COVID, you also have that, because while the disease starts probably with a respiratory infection and you first have problems with your lung, we now know that COVID also would infect almost every organ of the body. So there are these, maybe if you want, they're not really similar, but there are these likeness, but they're totally different diseases, because the pathogens are different, the way that these things react are different, the medication that you use for them are so different. So there are lots of differences between the two. Outside of that, you wanted to know whether somebody, if this is a comorbidity.
Yes.
Of course, we have seen patients who had underlying illnesses, and because TB can be one of those chronic infectious diseases, if you like, because they last for a long period, and especially if they're not properly treated, then that person's immune system can really be weak. And when you have a co-infection with COVID, it complicates the matter. We have had a patient, at least, that I know of, who had both of them, and it was very challenging managing that particular patient. So yes, persons with TB can have a higher risk of getting COVID, and if they get COVID, have a strong possibility, because of their weakened immune system, to end up in the hospital.
And lastly, if you're being treated for TB, could you still take the COVID-19 vaccine?
Yes, I don't see why not. Again, when you get a vaccine, and in this case the COVID-19 vaccine, it would help to prevent COVID from happening. After the first dose, say with the AstraZeneca vaccine, after 22 days after receiving the first dose, that start building the antibodies to resist the COVID-19.
All right, Mr. Anthony, thank you so much for speaking with us.
Thank you very much for having me.
That's it.